I want to welcome all of you to the Respite Voucher Learning Collaborative today. I'm Jill Kagan with Arch, and today's topic for our collaborative is using respite vouchers for emergency respite. Each of you will have a chance to introduce yourselves in the smaller group discussion that we plan to have following our presenters today. But if you'd like to say hello in the chat now, please feel free to do so. And remember to let us know what state you're from as well. I'm going to share my screen so we have some slides. Are you able to see those? Okay, good. Let's advance to the agenda. This is the agenda for today. As you can see, we have 3 members of our learning collaborative who have graciously agreed to share information about their emergency voucher programs. We have with us Tina Urick with the Illinois Respite Coalition, Yasmin Orozco and Jamie Ahumada from Nevada. After they present, we'll break out into a discussion in 3 different discussion groups to delve a little deeper into emergency respite voucher implementation, and then come back at the end to share any highlights that you'd like to share from your discussion. I did resend the discussion guide to all of you right before the meeting so that it would be at the top of your inboxes. And in a few minutes, I'll put a link to that as well as to the PowerPoint presentations in the chat. For the discussion, I'll go over the instructions after our presenters, but you all will have the same questions, but will be randomly assigned into groups. And then as a group, you can decide which group of questions you want to focus on. There are a lot of questions, and I just wanted to make sure that we touched on everything that might be of interest to the group. Before we get started, though, I just wanted to remind you all about the National Lifespan Respite Conference that will be held in Madison, Wisconsin, September 13th through 15th. The full conference program, including the keynotes, the plenary sessions, all the breakout sessions, are now up on the conference website at the link you see on the slide. I'm just really excited. We have some really wonderful keynotes and breakout sessions, including many of you who are presenting as part of the Lifespan Respite Trek. So we're getting really super excited about seeing all of you in person again. Just a reminder, early bird registration does end August 15th. So if you want to save a little money, make sure you register before then. I also wanted to let you know that we're already running a little low on discounted hotel rooms. We have a block, but the block fills up quickly. So I would suggest that you book your hotel room as soon as possible also. Even if you're not sure if you're coming yet, you can always cancel your hotel room. I think it's 24 hours before your first night of stay. And then in conjunction with the national conference, we are holding the Lifespan Respite Grantee and Partner Learning Symposium. This is for our invited state Lifespan Respite grantees and their primary partners. It will be held the day before the conference on September 13th. There's no charge for this event, but you do have to register separately for it. And the link to do that is up on this slide as well. You should have also received an invitation from me and from Lori with all of this information. If you did not receive the invitation or you need to see it again, I'd be very happy to resend it to you. Just let me know by email or in the chat. And there is a preliminary agenda up on the website where you register as well, just to give you a sense of what the day will look like, or if you need that to share with your leadership in your agency to get permission to travel. Does anybody have any questions about the conference or the learning symposium?
I actually have one question. Excuse me, sorry, a little bit of a rough throat there. For the reception, my travel folks need to know if dinner is provided or if that's just like a snack thing. It's in order to get approved, I have to estimate my meal costs.
The one on the 12th, that's just for the grantees and their partners, for those attending the learning symposium. That's just a 1-hour like wine and cheese reception.
That's what I figured. Okay, thank
No
you.
dinner. Sorry about that.
That's okay, thanks.
Would have been nice, but okay. Any other questions? Okay, then let's proceed with our wonderful presenters today. And I want to thank our presenters too for agreeing to participate and share the great work that you do in your states. Let's start with Tina Urick from the Illinois Respite Coalition, and I'll turn it over to you, Tina.
Oh, thank you, Jill, and thank you, everyone. I'm excited to be here because I've learned so much too. So I hope that, you know, there's a little something that everybody can get out of what Illinois is doing through their emergency respite and lifespan program. Next slide, please. So I've just got to take a minute to let you know who we are and what we do in our mission. So the Illinois Respite Coalition, we were founded in 1998 as part of a grassroots organization, and it was really led by caregivers and a few providers back in 1998 getting together to say, we need to make sure that respite stays important in the state. And I'm really proud to say too, that we have one of our board members, Maggie Lyons, who's the current president of the board of directors. She's been with us since the beginning, since 1998. The IRC is dedicated to increasing awareness of the importance of lifespan, promoting education and training for families and providers of respite services. We've done that all along, and sometimes even as volunteer board members when we didn't have some grants. And we are dedicated to providing support and advocacy to individuals across the age and disability. And we're really proud of that. Next slide, please. So we are a nonprofit. And currently through the Illinois Department of Human Services, the Division of Developmental Disabilities, IDD, we provide an in-home respite grant, and we do it statewide as of July 1st, except for Cook County. And we chose not to do Cook County because there are several providers there, and we were kind of hoping to make sure that we hit some of the other 101 counties. We also will be offering a voucher respite grant in 69 counties in central and southern Illinois. So southern Illinois, this is IDD specific. And then through the ACL and with IDHS DDD as our lead agency, we are really happy and excited to be able to provide emergency lifespan respite across the state and disability again. So Lori, thank you. We're happy to have this grant. The Illinois Respite Coalition back in, I think it was 2009 when the first pilot kind of came out on lifespan respite. The IRC was one who was funded during that first pilot for 3 years. Next screen, please. So we simply call our program ERC, and it is a one-time only voucher, and it's intended to help caregivers, of course, across the age and lifespan through the ACL Lifespan Respite Enhancement Grant. It's in a crisis or emergency situation, and so, you know, sometimes when you say emergency, you think, okay, hospitalization, death in a family. And the answer to that is yes, absolutely. And something that may even be, you know, planned like surgery, but it can also be for stress, extreme stress, or, you know, I talked to a family who hadn't had any support in 20 years. And when we started to talk about it, she just kind of broke down, not even knowing what respite is. So yeah, so I'll go through in a little more detail, but we're kind of broad on what emergency kind of means. We reimburse the cost of supervision for the caregiver's loved ones. So after the services have been used, the IRC provides information and referral to other services. So really our goal through the ERC is to be there initially to caregivers who have no other state or waiver respite funding. And then the secondary goal is, because this is just a small one-time stipend, it's really to link those caregivers to services that they may not know about, so that they can have some ongoing support. So the eligibility, it really is that you are a caregiver who you are caring for somebody with a disability of any age, and you are not receiving any other kind of state or waiver respite support. Next slide, please. So how do people apply? They can call us. We have a toll-free number. We also have Spanish speaking staff that can help assist. If we have somebody who needs another language, we have partnerships with other agencies that can help, and people email our statewide coordinator for information. We get referrals from agencies, from caregivers directly, and once we get that referral, then we'll start the screening process. And our screening process is to actually call and talk to the caregiver and find out what are their needs. We will be asking the questions: are they receiving any other services? And then we'll talk to them about, what kind of support do they need. We do allow caregivers to choose a family member as long as they are over 18. And then again, here too, is that they have a disability. For our emergency respite program, it really is something that they have to use within 30 days. We've gone out to 45 days based on surgeries or recovery, but this really is kind of a program that is there for you at a certain time of need. Next screen, please. So once we do the screening, if the caregiver wants to move forward and the caregiver is eligible, then we send out an application, which is about 5 pages, and it's fillable. We also send out a contract if they are going to be hiring through their funding somebody to provide the respite, and I'll talk about that in a minute. And if they're interested, we send that application and that contract out. Once we get that information back, we will confirm with the caregiver within 24 to 48 business hours. I can tell you that when we're on the phone, a lot of times, we will say, yes, this is going to be approved, get us the paperwork, the backup, so we can verify everything. And then we will send them, once they have sent us back the application and the contract, it has the dates of when they're going to be using the respite, and then we follow up with them. And at the end, we will send them a timesheet and a reimbursement check request form along with a survey. Next slide, please. So I thought it'd be easier to show. This is our contract. So how we explain it to caregivers is, yes, you're eligible for that $500. How do you know how you would like to spend that? Is that something that there's somebody that you know and trust already? to watch your loved one, or, is there, a place that you would like to take your loved one to? And so if they are choosing somebody, we say to them, you're gonna receive a contract. And basically what this does is it will be a contract between you and that person for when does the respite start, when is it going to finish, and what's that total number of hours, and what is that rate per hours, and that can equal up to $500. I'll tell you, the majority are eligible for 500. We do have families that, they're like, you know what, this is such a great program. If I can only use it once, I don't need the full 500 now. Can I come back if something happens? We're like, yes, you can. And so we do have, sometimes I had one person who just used $100 of it right now. And with their loved one's disability, there's not a lot of places to link them to other services. So that's a part of this program that we find is very nice for the caregivers. So this is a contract, and I kind of helped to explain it that, we don't want any misunderstandings of anybody coming back saying, Tina said we were going to pay $50 an hour. So we just make sure that things are pretty clear before any reimbursement. We've had this for a while. In here, it is a little strong because it does ask the caregivers to get back the paperwork in a 2-week deadline. We have that in there. We haven't had a problem with getting back the paperwork once everything has been received, because a lot of the time, if the caregiver isn't paying where we're reimbursing them, they want to make sure that the respite provider gets paid. So they make sure to get the paperwork in so that we need it. If they are using somebody for respite, we do make sure that we give them information on how to conduct a background check. We give them information all about, the CANTS and checking the National Sex Offender Registry. We've had a few families who have said, would you run background checks for us? And at this time, we just do. So it hasn't been a problem. So it's just something that if they ask us to do it, since we have it already set up through different contracts through the state from the in-home program, we just do it. And then we have them, sign the contract, and that comes back with their application. All right, next slide, please. This form is what's sent to the caregivers when we know that respite, emergency respite has ended, and that just confirms the respite hours, the total amount, and then who are we paying. And then that information is completed. For us, this is a form that's going to be revised. We are no longer going to be collecting Social Security or ITIN numbers. So hopefully that's going to open the door to more caregivers who are even more limited with receiving services. Next slide, please. And then this is our caregiver evaluation. Again, all of these things are fillable, and we've even had caregivers who are like, yes, we can do this on our phone. So if not, we will do this over the phone and help anybody that needs it. We just are getting back all of the responses. So the one thing that I can tell you about this program is from the funding that we did through FY22, 87% are female caregivers. 25% work full-time of those who received emergency respite. The relationship to the care recipient, 66% was the mother, and 67% provide full-time 24/7 care who have received emergency respite through the through this program year through June 30th. Household income less than 15,000, 25 or 18%. Caregivers earning between 15 and 25,000, 16%. 25 to 50,000, 24%. Unemployed, 20%. So we're still working on getting some of the data about age of the caregiver and recipient, but we were able to collect all of this information from the 5-page application, and then some of it through this application. Through this survey that went out, I'm happy to report that 97% strongly agreed with the program and the services that they received. We had 3 comments of disagree, and it was actually, one of them was I follow up with agencies resource and given to me, and one, yeah, they did not do that. Another one was they found the services easy to complete, and we had a disagree from one on that out of 140. But we're proud that we're still going to look at that in our services and see what else we can do through the process. But this isn't a new process for Illinois. Really, with the forms, we really use what was created before and have kind of been tweaking it along as we have had different voucher programs, and we were funded strictly for an emergency respite program a few years ago through DHS. It was not Lifespan. So we're really happy again to have the Lifespan Respite Grant. We had a late start with the kind of the kickoff once we heard that we were awarded, and that was just everything with our state agency and getting things together and started. But this is a program that the state agency and our lead agency, Meg Cooch, is promotes almost on a quarterly basis out on newsletters. But we had kind of a slower start getting it off by getting the funding available, not until December. But from just December really to date through June, applications sent, just to kind of tell you, 384. Applications received 201. So I think if you're thinking about respite too, you see that people will call, they'll get it, and then you just know sometimes with things going on in their life, it may just be sitting on that microwave until they're ready. So we only had that 201 in the 6 months that we received back, and then out of that 201, we reimbursed 140. So we had 140 received the emergency respite services in the 6 months. So yeah, we've had really just heard great response from it, and a lot of some of the questions for like screening and how do we know if they really need it is just in our application process. Like, we will ask, why do you need this emergency respite? How is this service going to benefit you? And then we also make sure that we will check to see if there's any other available sources at that time. And then we do ask if the care recipient would be at risk if the caregiver did not receive these services. And that's something that's important to us, that, if they are, then they're eligible. So we are kind of broad with, it doesn't have to be, a death of a family member or going to a hospital to be eligible. The real eligibility is that there really is that need, and we get that really talking to the caregiver or the agency. We get, a lot of referrals who, it's the agency that's worried about somebody that they're supporting. So this grant has really helped us to branch out with certain hospitals, and a sergeant at the Chicago Police Department who works with a lot of youth in especially harder areas in Chicago. And so we're going to be doing a presentation to some of the caregivers there too, to make them aware of this lifespan respite to eligible families. And I think that's all I have. I'm not sure there's another slide, Jill. Oh, well, yeah, there is. So I threw this in because I had the opportunity to be talking to all of you. So we are super, super excited that—
Just a reminder, Tina, you've got about 1 minute left.
Okay, then I'm going to wrap it up with this. Thanks, Jill, for saying that. So we're really excited that we also through Wisconsin and a training program with 11 other states. Illinois now has a virtual statewide respite training, Illinois specific, as of January. So this is something that we're hoping to get that registry to help link more caregivers. But I can tell you that we have had caregivers who are really excited that they can have somebody, their respite provider take a training that's across the lifespan. So that's all I wanted to say. I was really excited about that. And there you have it, it's our info. Thank you all.
Thank you very much, Tina. That was really wonderful. And I hate to cut people off when they have so much wonderful information to share. I'm going to turn it over right now to Yasmin and Jamie, and I'll let you go ahead and share your screen and do your presentations. And then we'll take questions for both presenters right before we go into the discussion groups.
Good afternoon, everybody. My name is Jamie Ahumada. I'm with the state of Nevada, and I have Yasmin with me. Go ahead, yes.
Hi, everyone. I'm Yasmin Orozco, and I'm with the Nevada Lifespan Respite Program.
Wonderful. Thank you so much, everybody, for having us on. We're really excited to share our emergency fund, respite funds for caregivers in Nevada. So, Yas, you want to share your screen?
Yes.
Sorry, I didn't realize it was on.
Just had it up. Sorry.
Pretty.
Yeah, that is pretty.
Just a second. What's going on?
I'm so sorry. Well, I can get started a little bit just to share a little bit of background. So our emergency respite funding assistance launched in November of 2021. We've had a few other cycles in the past grants in utilizing our emergency funds as well. We have simplified our process in receiving these emergency funds. The screen that Yas will be sharing is our flyer that we share across Nevada, so we can get in connection with caregivers who are in an urgent need of these funding resources. So ours is dedicated for an event a caregiver is experiencing that's an unplanned circumstance and results in just an unavoidable absence for caregiving of their loved one. And so we just share our contact information with everybody. They get in contact with our program coordinator and fill out an application. The eligibility criteria is pretty simple as well. It's just they have to be a caregiver providing care for a care recipient who has a chronic disease or illness or a physical disability or any kind of disability that requires assistance of a caregiver. And the process is, again, pretty simplistic. It's a submission of a referral form. Yaz, our coordinator, reviews that form, and my apologies, reviews that form for the needs assessment to understand what their need is, what they're looking for, and what we can assist with.
Yasmin, I think if you click display settings at the top, you might be able to get to the right presentation mode.
Okay.
Swap, see where it says swap presenter view and swap, there you go.
Perfect. If you want to go up one, Yaz, to show the flyer that we have.
How do I do that?
I think the arrows are on the bottom left of your slide. Oh,
There we go. And so we work with our caregivers as well. Yaz will go over the workflow process of all of that once the referrals are submitted to her for requests for emergency funds. We originally had it very specific to caregivers and getting respite in their home. It was self-directed. It was similar to a different pilot project that we did have. It was very self-directed. They were able to choose somebody from their natural inner supports if they had them, or they could choose a provider of their own choosing, and we would help with payment and reimbursement of those services. Through COVID and the light that it brought to all caregivers across the nation was many caregivers came across challenges of losing jobs, losing income ability. And so that started developing a large strain of financial stresses that added to their caregiving duties. At times we've had caregivers who were on the verge of being evicted while their loved one was bedbound, needed 24-hour support, and they just were in a panic. And so we had to pivot a little bit on our eligibility process and for these services, and really think about what can we do to alleviate some of these financial burdens or some of these burnout burdens that caregivers would have, and have that flexibility to be able to help them get a leg up and be able to continue to provide care to their loved ones. So our ability to help caregivers, we looked at it as very broad, similar to Illinois. It is pretty broad. We will help with actual respite services if they needed to be away from their loved one, but then we also looked at some of those huge financial burdens that they would come across as well, and work with them that way. The need just has to be, emergent. We would also look at long-term services and supports to help them get connected to long-term services and supports, get them connected to respite services throughout our state for long-term. And then we would also just take a look to ensure that if we did help them with this one-time assistance, that they could continue moving forward with their caregiver responsibilities. So we just ensured that sustainability. And again, this is the flyer that we use to promote our respite emergency funds. We help people get connected to Yaz. Yaz really takes a look at that and provides them resources and information. And she'll talk a little bit more about that process and just really get them connected, and then be able to also utilize our emergency funds. Go ahead, Yaz, next slide, and you can take it over.
Okay. Thank you guys for your patience and my technical difficulties. So with the eligibility process workflow, I usually receive a referral, and that may come from a family resource center, It may also come from any of the different organizations locally. I've received applications from local hospitals, hospices, and schools is another big one that I receive referrals from. So as soon as I get a referral I make sure I look at the application and I make contact with the primary caregiver listed. And then I just, kind of hold a review and being able to talk to them on what their emergent need is. And I'm able to really dig in deep into finding out, okay, how are we gonna process some of the bigger needs that they may have? As Jamie said, we always look for a way to help them in that emergent need situation that they are experiencing, as well as the long-term care supports that we can connect them to, either because they are not aware that they may qualify, or they're just simply not educated on the different resources within their service area. After I review the application and we determine the eligibility, I always check in with Jamie and we debrief on the process of what the emergent need is for the caregiver. And once we approve we make a decision and we either approve or deny the applicant, we can move forward with the next steps. And so the approval process, I usually document all of the needs that they have. So for example, if it's an emergent need where they are about to be evicted, and ask for that eviction notice, so we can get connected to when I put in the request, I make sure to notify and document who the check will be written out to. In this way, the physical agent office knows as well. And some caregivers do have to either be denied or they withdraw their application, either because they get connected to other resources and organizations and supports within the area that they need. And so they withdraw their application, and then others are simply denied, based on their eligibility. I always follow up with each caregiver as they are approved and their check is processed, just to make sure that the check was received, and I'm able to follow up to see, what other needs they may have that I may have not been able to provide them any resources to. And so I usually always refer to Nevada Care Connection, any other family resource center. Sometimes it could be the Alzheimer's Association, Division of Child and Family Services. And those are just some of the ones I can think off the top of my head. And as we follow up, we have found out we have had 76 caregivers that have applied for the emergency respite funds. We have had 38 caregivers that were approved. And we had 22 caregivers that were denied. 16 caregivers withdrew their application. We have had 64% caregivers that applied for the emergency funds that were single caregivers, caring for one care recipient. And we had 36% caregivers that applied for the emergency funds that were compound caregivers who are providing care to more than one care recipient. Another interesting statistic that we have been gathering with the referral form has been the ages. We have had 49% apply that are within the age range of 22 to 59 years old. We have had 15% that are in the age range of 60 to 64, and 12% were 65 and over. And like I said, caregivers are always connected to other service supports and organizations And we always try to provide guidance and referrals on information. And we just always try to support our caregivers in need as they're trying to, escape this emergent need and find a solution to their emergency situation. So this is the workflow. And then our next slide. This is the referral request form that we are currently using. And we're able to have a lot of different demographic data, which helps me in the eligibility process. And I always end up filling out a little bit more extra on the needs of each family caregiver. As like I said, sometimes they come in layers of needs that they need assistance with. And since we started the emergency funds on November 1st to May of 2022, we have had a total of 91 caregivers that have applied to the emergency funding request. And I have had documented about 144 phone calls so far that I have been able to speak to. We have had, since May of 2022, we had an allotted amount of $44,943.03. And since then, we have continued our assistance for respite care needs of a caregiver in an emergent need. And I have worked through making sure that as I research and work through the support services that each caregiver needs, I'm able to follow up with making sure that each caregiver receives an application. And I do follow up to make sure that they do fill it out, or at least I provide them a resource that they can be connected to, either with a case manager or another point of contact that they can have access to. And with our data that we collect after the caregiver receives the funding, I always follow up as well to have them provide their feedback on our caregiver satisfaction survey. And that's available to fill out online or through their phone. And we have had 41 caregivers successfully provide feedback and information that we will be able to continue to hear back service feedback on how they like the self-directed voucher of the emergency respite funding. And we hope to see the number continue to grow as we are still collecting the rest of the emergency respite funds that are still available for them to apply. And oops, sorry.
To me, as Yas said, we do our best through our process to be able to connect to the different resources that are available to them. And we just wanted to share some additional information regarding, the awarded amounts that we've provided to our caregivers. Out of the 38 caregivers that have been awarded, we've had 6 caregivers that we've provided funding of $500 or less. Our 12 of the caregivers out of the 38, anywhere between $500 and $1,000. 14 is $1,200 to $1,500, and 6 of the caregivers is $15 to $2,000. And then we gave a little bit of a wheel of just what that really entailed. It was either medical expenses that needed to be paid, utility assistance, in-home respite, or rental assistance, or mortgage assistance. Again, we really had to broaden the way that we could help our caregivers in providing them respite, even if it was this relief of a financial burden. We realized that they were just many of the care, I would say a high percentage of the caregivers that come through are completely coming to just dead ends on in so many ways. And us being able to be flexible in the way that we help them has been so beneficial and so rewarding as well, to kind of see that we can be that flexible and help them continue moving forward with their families. So we're happy to share that information and and answer any questions that you may have.
Thank you both. That was a really very informative session. Thank you for sharing all of that. If you wouldn't mind, stop sharing your screen, Yasmin, then we can see each other. Let's take about 5 minutes just to see if there are any questions related to those two presentations before we split up into our discussion groups. Any questions for Yasmin or Jamie?
All right. I have a simple question. For Yasmin or Jamie, I think Yasmin, but NVCC, you may have said, is that the Nevada Caregiver Coalition or something?
Oh, it's Nevada Care Connection.
Okay. Is that like your ADRC or something?
Yeah,
So
that's our ADRC.
So my simple question builds. So like the people with the rental and other assistance, you through the ADRC, you can connect them to like a HUD or a LIHEAP kind of program. I mean, give them that stopgap, like you say, and then you start working with all kinds of resources to make sure that this is not that they become stable again.
Yes, our primary goal when Yaz and I really debrief these cases, particularly for those, so we look at that emergent need. So if they're going to be evicted in 2 days,
You're right.
We tend to that, and then we get them connected back to our ADRC. So then that way they can look for that long-term solution,
Yeah.
and it not be a Band-Aid, because we're always afraid of if we pay for it, but they have no plan or there's no other connection to other resources, then they're back to one next month.
I think that'll make some interesting discussion in the breakout, but it makes sense. It's like respite is a break or a stopgap or a measure to prevent overburden. So that's really interesting. Thank you.
Thanks.
Just wanted to make sure I knew what the acronym was, and then I fell down the rabbit hole.
Thank you.
Any other questions? Lynn,
I
see
do.
your hand up.
I do. Yes, thanks.
Rosalind too.
Yeah, I noticed you said something about a denial of service, which, kind of made me go, oh, what are how do you how do you know, how do you determine who gets services and who doesn't, I guess was my question.
You want to go for that, Yes?
Yeah. So with our denied applications, they have been because they have needed caregiving respite support for a longer than 6 weeks period. And a lot of the times they need assistance with paying out-of-pocket therapies, being able to have a little bit more of that support with medical supplies. So it has varied, and a lot of the applicants that were denied, they just really needed that long-term support. But like Jamie and I have always debriefed on, is we've always provided for them 1 to 3 options that they could have, so that they don't feel like, oh, I just applied and I'm denied, and where do I go from here? So that's my biggest hurdle, is determining that their long-term needs is something that we cannot sustain on a long-term need. And so we just continue to find those resources out in the communities that they need, and just help them apply.
And sorry, yes, I just to interject too, it really is, it's not just a denial and it's the end of it. It really is, we connect them to long-term services and supports, because that is what they actually were looking for and what they needed. And so that's where that denial comes in. Some of the people just withdraw their application like, oh no, when we give them those resources and they're like, no, that's actually what I was looking for. We just thought you were a program that can help me every week or every month, you know, moving forward. And so then once we get them connected to those correct resources, then they just either withdraw, or we just, you know, say, we'll get you connected, we'll do the warm handoff, and then we'll just deny you from these specific services, and you can use them if you do have an urgent need in the future. Great question, thank you.
No, very good questions, everyone. Any other questions before we move to a
Rosalind.
break?
We have Rosalind.
Okay.
Two things. One, real quick, I'm excited to hear that you're kind of expanding the definition of respite by providing resources that are urgent need kind of things, because that will definitely take a relief off of somebody. I mean, it just sounds that would be a big help. And then doing the warm handoff, as you're saying, to long-term services. The other question, it sounds like what you're doing is a lot of case management, I would imagine. Does this take a lot more time than the typical lifespan respite voucher would, the urgent need one? Because it sounds like you're doing a lot of warm handoffs, a lot of back and forthing, a lot of work. And I would wonder how much more time it would take staff-wise to use this model.
Yeah, so it does take more time. There is elements of case management, because we've realized that when caregivers are at this burnout, at this very frustrated phase, like giving them additional forms, giving them additional hoops to go through, we lose them in that process. We had found that through our Respite RX pilot project that we did a couple of years ago, you know, even then to get them to get onto our services, sometimes it's just too much for them to go through. And by dedicating just that extra time, we can alleviate that urgent need and then really get them connected to resources so they stop coming back, you know, to us. And so it does take some time, but I think the quality outcome of that piece is a lot higher than kind of quickly processing them and giving them a number and saying, call them, and, you know, and we try to kind of help them navigate that a little bit. If it becomes a very complex issue where it's more outside of Yaz's scope, then we do the warm handoff to our resource centers, and they pick it up from there and they take it on and they work through those complexities and longer case management piece of it.
Right. Well, thank you. I just, you know, thinking about programming, you know, you want to make sure that you're keeping that in mind. I would, you know, on my part, I would want to definitely do that. Thank you.
Yeah.
Yes. Anybody
One
else?
more question before we go to breakout, anyone?
I had one real quickly for both states. In addition to these emergency programs, are you all offering the typical respite vouchers, or it is only the emergency vouchers? And maybe I missed that. I'm sorry.
For Nevada, we do the emergency voucher specifically through this grant funding. We have other state funding that does respite vouchers or waiver programs. And so we get them connected to those services as well when eligible.
Hi, and yeah, so from Illinois, yeah, so we have our lifespan respite for the emergency. And because we have the emergency DHS, DDD, kind of pulled that out of the last notice of funding opportunities, having in-home providers put aside some of their money for emergency respite because they really want emergency respite to go through this lifespan piece. But we also here, the IRC also has an in-home grant that's specific to IDD and also with a voucher for IDD.
Wonderful. Thank you, everybody. Really great questions. I appreciated all of your questions very much. Let's move into the discussion groups. As I mentioned earlier, We will just do random assignment to the breakout rooms, and each room will have a facilitator. One room will be Aida from Sooner Success in Oklahoma, and Talina Ford with the Oklahoma Lifespan Respite Project. They're both leaders for this collaborative, and I'll be in the third group. We did set aside 30 minutes, but I think we'll now shorten that to 20 minutes because we had such wonderful questions we wanted to all hear the answers to. Again, refer to your discussion guide that was sent to you in advance of the meeting. I also put a link to it in the chat if you don't have that right in front of you. There are a lot of questions in that discussion guide, and I don't want you to all feel obligated to rush through all of those questions. There were just so many potential topics under this topic of emergency respite. So as a group, you may want to just look through the major topical areas and decide which of the groups of questions you want to focus on. It's totally up to you. Each facilitator will attempt to record the session so that we do have a record of it. And then we'll come back to the main room for the last 10 minutes or so if anyone wants to share highlights from their small discussion groups. And they will be very small today because we have a small group to start out with, but I think it still would be helpful to move into those discussion groups so you can develop those one-on-one relationships with other grantees in the network. And again, we encourage you to turn on your camera if you have the bandwidth because it makes those discussions so much more easier to engage in. Any questions about the discussion groups? Okay, I'm going to randomly assign you. If you want to, I think if you want to move to another one, you can, but this will give you a chance to meet some new folks, hopefully. You may have to select the room you want. There you go.
Well, Jill, like always, we run out of time, but it was great discussion.
I think we lost a lot of people between the big group and the small group. Well, maybe not. Here come more people. People are still coming back. We had such a small group to begin with. We probably could have just continued with the questions with everyone, but I think it's nice to have the smaller groups and really get to put a face to a name. And maybe one of the goals for this learning collaborative is really to let you know that it's okay to reach out to your colleagues in the group outside of the learning collaborative. And so the more personalized relationships you can build with them, the easier it is to do that reach out. So we hope that that's helped you. Does anybody have any major highlights from their small group discussions that they might want to share? Something you didn't know before that you learned from your colleagues?
I don't mind going.
Go ahead.
Quickly. Flexibility was a big takeaway. I think I know as a program here in Oklahoma, the emergency voucher programs allows us more flexibility to help those family caregivers with an immediate need. But fast forwarding to more towards the end of our discussion too, is really the question around planning, helping family caregivers plan. It was brought up again, we ran out of time, but the big takeaway is just being really proactive in terms of in the event of, so preparedness. The wildfires was brought up by Cheryl in their state, and those family caregivers that are having to quickly be displaced due to a natural disaster emergency. And so just doing our part really in trying to help family caregivers, obviously with emergency vouchers, respite access, thinking through what that might look like so that they are better prepared in the event of an emergency. But I also made some notes about the barriers, Jill, that again, maybe nothing new, but our group really talked about awareness that family caregivers are unaware of whether it's emergency or other resources, and also self-identifying as family caregivers. It matters the terminology that we use, because regardless of where the family caregiver is in their journey, perhaps they may not recognize like that's me. So just being mindful of that, and as we're trying to get the information out there, have language that could reach those family caregivers that may not personally identify themselves, but they are a family caregiver. And also that obviously a big barrier too is language. And so just when possible, having staff that have the same native language as the family caregivers, whether that's Spanish or other languages, when possible, is so important. But just recognizing that as we're trying to reach all family caregivers, certainly language can be a barrier as well. So there's more, but I will stop to allow time for others.
Talina, anything from your group or anyone else from your group?
Well, I love that we are all just thinking the same thing. So, Aida covered quite a bit of it, but we talked about by definition, emergency just being difficult because it is an emergency and the process being lengthy, whereas the need being immediate. And Colorado shared that there was some low utilization due to finding provider challenges to fit what is needed in that moment. And then we talked about being able to hire those family caregivers, those family members that are in the home and or the neighbors, and just Tina talked about when we were discussing developing a plan for emergency, it's really identifying who your village is and really honing in that village and letting them know, here's where I'm at, what I'm doing, and this is what I need. And but again, developing a plan is difficult because it's so individualized. And so it would mean one-on-one with each individual going over various different things in order to make sure that that plan is useful when it comes needed. And then, again, the greatest barrier is just the process and making the process worth it to those caregivers and not just creating another something they have to do. And then the definition of an emergency, that one we talked about for a little bit, and it was interesting. Amy asked about gap filling for providers. So if they have a normal provider, but then they're not able to provide that, is that constitute an emergency? And I'm sure for the caregiver it does, but does it for us as the respite voucher holders? So that's what I have.
Yeah, that is amazing that our group selected as priorities the same group of questions that you all focused on. And so of course we started off talking about barriers for family caregivers to access emergency respite and immediately went to the respite provider issue. I mean, we already have a crisis in availability of respite providers. And then when you're looking for providers who might be available on a less than 24-hour notice, then you're really running against a brick wall, that there may be very few providers, especially in the formal service system, that are able to do that, either because they don't financially want to reserve space on an emergency basis, or they might have administrative barriers. I know we've learned about programs that might have requirements for proof of immunization or TB tests, or now probably COVID immunizations. By the time you get that documentation, the emergency has passed. So the provider issue remains a major barrier for family caregivers. And then of course that led us right into who works with family caregivers to help them plan for emergency respite use. And most people haven't really done that with family caregivers unless they're maybe using our life course respite tools that could help in planning for respite in advance, identifying those providers in the community who might be willing to take someone on a short-term notice. And thinking about how we might do some planning. And I let our group know that we just awarded an Innovative and Exemplary Respite Service Award to a nonprofit entity, specifically because they have put in place emergency planning for respite. And so I'll make sure that I send you the name of that organization and the tool that they're using too. It might be very helpful. And if others of you have tools for emergency planning, we'd love to see those as well. We also talked a little bit about guidelines for emergency, what constitutes an emergency. And there have been a few states that have put in place very stringent criteria for defining what is an emergency, just to differentiate it from their regular respite voucher program. And so those tools are available on the Arch website. I think I sent around a link to those guidelines. I'll send that around again if you're interested in that. And then again, around outreach, we talked about maybe some non-traditional stakeholders and partners that you have not worked with before. If you're trying to let family caregivers know that you have emergency vouchers, might be, adult protective services, child protective services, first responders, hospitals and other medical care professionals that certainly are dealing with families in crisis situations. And I know Jamie talked about how they get a lot of referrals from hospitals in Nevada. And just rethinking who's in your coalition. Do you have these folks who are on the front lines of families and emergencies every day, part of your network, so that respite can play an important role in preventing a crisis from escalating to something even worse? So I think did I miss anything in my group about any of the major? We did a lot, 20 minutes.
And Jill, you help remind me to revisit my notes. Informing those providers is so important. As we're trying to reach family caregivers, they're in a great position to have the information on emergency and respite vouchers. So again, I think it's important that all of us, as we're trying to reach those family caregivers, And perhaps our coalitions are a great platform to get those providers more knowledgeable of the emergency and typical respite vouchers. But this has been great. Thank you.
Thank you all. Really, there's just so much we can talk about on this topic. I didn't realize how many ways we could talk about emergency respite vouchers until I started developing the questions for this discussion guide. So if at some point you want to explore these questions, maybe in greater detail and some more breakout groups, we can certainly schedule that if there's interest. So let me know. Any other closing thoughts that anybody might have? From our presenters, Tina or Jamie or Yasmin? Any last thoughts?
I just wanted to say kudos to Nevada and to Illinois. Thank you guys for taking this on, a challenging work.
Yes.
Thank you so much. And thank you for having us and participating in this. So thank you very much.
I love our network. You're so generous with your time and information. Thank you all so much. And we'll meet again in 3 months for this collaborative. And I hope you're all having a wonderful summer and all of you will get a chance to have at least a little bit of a vacation. And I hope we will see you all in Madison in September in person. Take care, everybody. Have a great afternoon.
Bye-bye. Thank you. Bye-bye.
Thank you.
Bye.
Bye.